Thank you so much for this opportunity to join this distinguished panel. Thanks to the Endourology Society and of course to Boston Scientific for supporting this educational event. I am going to be talking about the Trilogy experience in the United States and specifically a multi-center trial that is currently in press. Here are my disclosures. So when we talk about the quality of evidence, we really need to consider how trials are designed. And one of the benefits of this particular trial is that much like the European study, it's rigorously designed as a multi-center prospective randomized trial, which is intended to compare Trilogy to really a similar dual energy, single handpiece or single probe lithotripter. And so in this study, the Trilogy was compared to the Shockpulse. The Shockpulse has been shown in prior studies to have superior stone clearance to the commercially available lithotrites, such as the LUS2, the Cyber1, and the LithoClast. And we were shown earlier that preliminary in vitro data demonstrated a reduction of about 50% in mean lithotripter clearance times using 1 centimeter Bago stones for the Trilogy versus the Shockpulse. So in this trial, there were 100 patients undergoing PCNL that were randomized 1-to-1 to Trilogy or Shockpulse. The inclusion criteria were stones that were greater than 2 centimeters in diameter or greater than 1.5 centimeters in the lower pole. Patients that had either anticipated multiple access or had had recent shockwave lithotripsy were excluded from this trial. As in the prior trial that Dr. Wiseman discussed, the primary outcome for this trial was to look at the clearance rate of the targeted stone burden. We wanted to look at the stone clearance rate as well as stone clearance time, but secondary outcomes were also considered, which are important when we talk about comparison of devices, such as device malfunctions, what the stone-free rates are, how often we did a secondary procedure, what complications, then of course, what's the satisfaction with the device. So the study hypothesis was that the Trilogy and the Shockpulse would both demonstrate superior stone clearance to previous lithotripters, but that the Trilogy would outperform the Shockpulse for harder stones. In this particular study, harder stones were identified as composition of brushite or calcium oxalate monohydrate. There were 7 surgeons at 3 high-volume stone centers that enrolled patients. And we were previously discussing the benefits of accurately determining stone volume. This study was unique in that it used a software program called the Quantitative Stone Analysis Software, the QSAS, which was developed at the Mayo Clinic in Rochester, Minnesota, to very accurately determine in an objective fashion stone volume as well as density as measured by Hounsfield units. In all of these cases, a 24 or 30 French percutaneous access sheath was used, so more standard PCNL, not mini in this particular study. Postoperative imaging included a CT scan on postoperative day number 1, and then a KUB and renal ultrasound to determine overall stone-free rate between 6 and 12 weeks post-surgery. Whether secondary procedures were performed was really at the discretion of the surgeon. So here is a look at the preoperative data comparing the patients that were randomized to Trilogy versus Shockpulse. And as you can see, very similar in terms of patient characteristics of age, gender, and BMI. We do not have super thin patients here in the United States. And so I think this is a very accurate representation of the patients who are undergoing PCNL in this country. In addition, very similar in terms of target stone volume and surface area between the two groups, and in density of stones. As you can see with Hounsfield units over 900, there were a large percentage of hard stones in these in this trial. So let's look at the results. Case duration very similar between Trilogy and Shockpulse, between 104 and 121 minutes. Stone clearance times were really similar at about 5.84 for Trilogy and 6.73 minutes for Shockpulse. When you look more closely at stone clearance rate per surface area, which is measured in millimeters squared per minute, again, no difference really between Trilogy and Shockpulse. However, if you look at stone clearance rates, considering volume, which again, we've now said multiple times really makes a difference, this is measured in centimeters cubed per minute, much superior, statistically significant benefit in using the Trilogy over the Shockpulse. And then when you look at outcomes in terms of residual stones, the Trilogy group had much less residual stones in the size of 4 to 10 millimeters compared to the Shockpulse. Shockpulse had 22% with residual stones of 4 to 10 millimeters versus only 12% in the Trilogy. And by definition of this, the secondary procedures being at the surgeon's discretion, it's not surprising then that the number of secondary procedures for the Shockpulse group was substantially greater than what we saw in the Trilogy at 34.7% versus only 17.7%. However, it should be noted that the overall stone-free rates for both groups were similar, and the percentage of hard stones in each group was similar. And this is just a graphical representation of stone volume in centimeters cubed and clearance time partitioned by the lithotripter type Shockpulse versus Trilogy. And really all it's demonstrating is that compared to Shockpulse, Trilogy reduced the anticipated increases in clearance times that you would see with larger stones. So we talked a little bit about stone clearance rates, which was clearly the primary outcome for this study. But I think it's important to consider anytime you're introducing a new technology, the device malfunctions and the satisfaction with the device. So this was measured in this study. Again, the surgeon satisfaction was measured on a Likert scale of 1 to 10, and really similar between the Trilogy and Shockpulse. What was different was the number of device malfunctions, with substantially more device malfunctions for Shockpulse than for Trilogy. And most of the device malfunctions were due to clogging or issues with suction of the Shockpulse. We saw in the prior presentation comparison to other commercially available lithotrites. I think it's important to understand that these were not compared head to head in any particular trials. So they, these clinical investigations aren't directly comparable, but I think it gives you some idea of the magnitude of stone clearance compared to what we have traditionally been using. So as Dr. Wiseman mentioned, the stone clearance times for CyberWand, LithoClast, and Stonebreaker have been around 23 to 28 minutes, with stone clearance rates between 24 and 32 millimeters squared per minute. In comparison, in this recent trial, Trilogy has been shown to have a stone clearance rate of 5.8 minutes, which is substantially less, and a stone clearance rate of 101 millimeters squared per minute, which is much better than what's been published for these other commercially available lithotrites. In addition, the device malfunctions for these other lithotrites have been anywhere from 9 to 32%. So again, Trilogy with 1.9% is substantially less. So really, it seems to be a major improvement upon what we've been using in the past.